United States' main goals to work with the government and other development partners to support the Sierra Leonean people's desire to live healthy, prosperous lives. Through the U.S. President's emergency plan for AIDS relief, the United States will continue to support Sierra Leone's efforts to surpass 95 goals by 2030. Working closely with the Global Fund, the Ministry of Health, and all partners in the health sector, we have successfully expanded the number of supported HIV testing and treatment facilities. We have coordinated drop-in center engagement to be responsive to the needs of clients. We have collectively conducted root cause analysis to identify where we need to focus our efforts to achieve epidemic control. In furtherance of this work, the United States will invest more than $8 million this year to support HIV/AIDS care, treatment, surveillance, and laboratories in complement to what the Global Fund is bringing to the table through this new grant. Through the President's Malaria Initiative, the United States will also continue to support wide-ranging efforts to reach zero malaria by investing an additional $16 million this year. These funds will be used to procure bed nets, malaria medicines, and malaria tests. They will also support the Ministry of Health to deliver these healthcare commodities and service delivery at clinics and through campaigns. Furthermore, we are supporting the Ministry of Health to continue to strengthen its community health worker program. More than 25,000 healthcare providers have already been trained to detect and treat malaria cases and are providing life-saving care for their communities. They provide a wide range of services that include basic care for the diagnosis and treatment of malaria, diarrhea, and pneumonia in children under 5, as well as facility referral services for cases of severe malaria. The United States sees enormous potential in expanding this community health worker program, and we're committed to continuing to do so by supporting incentives for these workers in Falaba, Callao, and Bujan districts here in Sierra Leone, and we applaud the use of Global Fund resources as laid out in this agreement to expand that program even further throughout the country. Global Fund grants have made countries better prepared to respond to emergencies post-COVID-19 by strengthening health security, investing over $1 billion a year in key components such as community health workers, disease surveillance systems, the know-how to use the investments that are essential for progress in the fight against AIDS, tuberculosis, and malaria to reinforce community capacity, better prepare for future pandemics, and ensure sustainability of national health systems. In closing, let me join my colleagues in congratulating Sierra Leone and the Global Fund in launching this 7th grant cycle. I know the work that has gone into this, particularly by the country coordinating mechanism, and I look forward to seeing the impacts of this investment in lives saved and improved health for Sierra Leone. Thank you very much.
Thank you very much, Ambassador Hunt, for those words of support. I also now proceed to invite a committed partner to Sierra Leone, the UN Resident Coordinator, Serafin Wakana, for remarks. A round of applause as well for her.
His Excellency, the President of the Republic of Sierra Leone, Ministers of Government, members of Diplomatic Corps, the Vice President of World Vision International, the Chair of CCM and members of the Secretariat, the Global Fund delegation, all health practitioners present, distinguished guests, good morning. It's a great honor to join you today for the launch of the Global Fund Grant Cycle 7. And this occasion marks another significant step in our collective efforts to combat HIV/AIDS, tuberculosis, and malaria in Sierra Leone. The partnership between Global Fund, the government of Sierra Leone, the UN, development partners, and all stakeholders has been instrumental in making substantial progress in the fight against these diseases. And over the years, the Global Fund has provided critical support that has saved lives, strengthened health systems, and improved the well-being of countless individuals across the country. And despite significant progress made by the government of Sierra Leone in fighting HIV/AIDS, the battle is not yet over. As we speak, 1.5% of Sierra Leone's adult population is living with HIV. While this prevalence is among the lowest in sub-Saharan Africa, this 1.5% represents individuals, men and women, who have the right to achieve their dreams and have a dignified life like everyone in Sierra Leone. Every life counts. No one should be left behind. Over the past decades, the government and development partners, together with local communities' efforts, have led to significant strides in combating malaria. The distribution of insecticide-treated bed nets, the indoor residual spraying, increased access to quality treatment, and the recent launch of malaria vaccination in Sierra Leone are all contributing to declining malaria rates in many regions of the country. However, despite these laudable efforts, malaria remains a public health concern that requires continuous synergetic action from all stakeholders. And today, as we embark on the 7th cycle of Global Fund grants, we are reminded of the resilience and determination of the people of Sierra Leone. And despite the many challenges faced, including the recent global health crisis, Sierra Leone has demonstrated remarkable commitment and progress in health and development. Your Excellency, under your leadership, Sierra Leone has made significant strides in aligning health initiatives with national development goals and the Sustainable Development Goals. HIV, AIDS, and malaria disproportionately affect the vulnerable population, those already grappling with poverty, lack of education, and limited access to health services. The stigma associated with HIV continues to be a barrier that prevents many from seeking testing, treatment, and support. The United Nations in Sierra Leone remains committed to supporting the government and communities through transformative initiatives and strong partnerships to ensure that the health systems are robust, inclusive, and capable of meeting the needs of all Sierra Leoneans. The launch of this new cycle of funding is a vital step toward accelerating progress and achieving sustainable health outcomes. I would like to take this opportunity to express my heartfelt gratitude to the Global Fund for its unwavering investment in Sierra Leone. The impact of your contributions cannot be overstated. And from reducing the prevalence of HIV, TB, and malaria, to enhancing the capacity of health workers and improving healthcare infrastructure, your efforts are making a tangible difference. As we move forward, let us continue to work together with renewed vigor and determination. Let us leverage our collective expertise, resources, and commitment to ensure that the gains we have made are sustained and that we build a healthier, more resilient future for all. I would like to conclude by thanking you, Excellency, the President of Sierra Leone. Your presence here today is again a testament to your personal and government commitment to strengthening the health system and increase the well-being of Sierra Leoneans. I also take this opportunity to recognize the contribution of all partners and the dedicated health professionals who work tirelessly to deliver life-saving services to those in need. Your efforts are the backbone of our collective success. And together, we can overcome the challenges ahead and achieve our shared vision of a Sierra Leone free from burden of HIV, TB, and malaria. I thank you all for your kind attention.
Thank you, Madam Wakanda, for your partnership and sustained collaboration in the health sector. Your Excellency, Parliament guarantees a significant oversight in the health sector, and therefore it's my pleasure to invite the Chairperson of the Health Committee in Parliament, Honorable Weata Bernadette Tsonga, for a 5-minute remarks.
Thank you very much. Please pardon me, my voice is not very good, and so I'll be very brief. Your Excellency, the President of the Republic of Sierra Leone, please permit me to stand on existing protocols. Parliament, we are glad to be here, and we are honored to be a part of this laudable event. The committee in Parliament, the Health Committee, is a Class A committee. And as such, from the 5th Parliament, we have worked collaboratively with the ministry, and we remain committed in ensuring that our works becomes easy by passing into law 7 bills in the 5th Parliament. And this Parliament, the 6th Parliament, we're more determined to pass more laws that will make their job really easy. This was made possible through the political willpower of His Excellency and the leadership of Parliament. The committee on its own, please, I'm sorry. The committee on its own have been doing a lot of oversight roles, very robust ones, since coming back in the 6th Parliament, and I've been the chairperson of the committee. We've worked collaboratively and we've intensified our commitments to the ministry. We've worked through a lot of things that we've done with their partners. Last few months ago, some of my committee members were in Benin, participating in the malaria conference, determining the roles of MPs in combating malaria. And by next week, 2 of my committee members, including myself, will be going to apologies. Next week we'll be traveling to Nairobi to also participate with the judiciary in studies of the HIV and AIDS Secretariat. These 2 secretariats have worked tirelessly, and they work very closely with Parliament. And we're looking forward to working more with them as a committee. We have engaged the ministry in several lawmakings, and we are assured that these laws will help what the Global Fund have committed to do for Sierra Leone. We want to reassure Global Fund that the funds given to Sierra Leone will commit to doing even more robust oversight roles to ensure that the funds disbursed will be used appropriately, and health facilities will be fit for purpose in carrying out their roles. We want to thank you, and we want to thank the HIV Secretariat for all they do for Sierra Leone. We want to thank Global Fund. I wish my voice was really good, but just to express that we are really excited for what you do for us, which is why I'm here. I'm really sort of pushing to speak to you. We are very grateful as a Parliament, and will continue to be committed. Thank you.
Thank you very much for that shortest 5 minutes. And we wish you speedy recovery with your voice. Your Excellency, at this stage, we will now invite Mark Eddington for the presentation of the check for the GC7, as he is the head of Grant Management Division Global Forum. Mark, you're welcome.
Your Excellency the President, I'm going to stand on existing protocols, learning from the very brave Chair of the Parliamentary Health Committee. Good morning and thank you for the warm welcome to Sierra Leone. I'm here today with staff from the Global Fund, including our Chief of Staff, Katie Camp, and our country team for Sierra Leone. We are delighted to be here in Freetown today to celebrate the launch of these Global Fund grants. I'm afraid that before I hand over the symbolic check, Your Excellency, you're going to have to listen to me for a little while, if that's okay. We've been working in partnership with Sierra Leone since 2005, with cumulative funding of around $500 million. Today we're launching new grants worth $136 million for the period June 24 until June 27. And we see these as an investment in your national health programs. We don't see them as a project. I'd like to say thank you to the previous speakers, including the Chief Medical Officer. And Chief Medical Officer, thank you for your honesty and transparency on the lessons learned from the current grant cycle, in particular the need to start up quickly. The key to finishing is starting, right? So let's hope we see that lesson put into action. I'd like to take the opportunity to express our appreciation for the strong commitment that the government and people of Sierra Leone have shown to the Global Fund Partnership, and we are a partnership. We recognise the efforts made to fight the 3 diseases and strengthen systems for health under the leadership of the Honourable Minister for Health, Dr. Austin Denby, with support from many partners in country, including our principal recipients, World Vision International and Catholic Relief Services. I'd also like to thank the Global Fund donors present here today for their support over the years. Our last replenishment showed their commitment to the partnership's mission with a record pledge of $15.7 billion for the 3 diseases and resilient and sustainable health systems. In addition to over $5 billion to fight COVID-19, most of that from the US, thank you, Ambassador, and mitigate its impact on programs for HIV, TB, and malaria. This allowed us to react quickly to what was then a very new pandemic. And the continuous support of donors to the Global Fund allows us to be here today to launch these grants. Your Excellency, Honourable Ministers, distinguished guests, today global health and the prioritisation of health and health systems are competing with multiple challenges, such as conflicts, the geopolitical environment, climate change. The Global Fund Partnership will, however, continue to invest in efforts towards ending HIV, TB, and malaria by 2030 and partner with Sierra Leone in support of the government's priorities to fight the 3 diseases and build resilient and sustainable health systems, in addition to preparing for future pandemics. Hopefully we won't need that preparation, but let's prepare anyway. I'd like to extend our appreciation to the Sierra Leone Country Coordinating Mechanism, the principal recipients, development partners, UN family, and all other stakeholders for the hard work and support provided to ensure the successful implementation of country health programs and Global Fund grants. Throughout the years, the partnership has achieved important results in Sierra Leone. Let me share with you just a few successes and progress milestones. For HIV, good progress towards the 95 targets. Now 78% of the 77,000 people living with HIV are aware of their status. 97% of those who know their status are on treatment. 45% of people on treatment are virally suppressed. We need to make some progress on that last one, and we discussed that last night at dinner, Honourable Minister. It was also possible to reduce human rights barriers, including the provision of legal retainers, training of paralegals for key populations, and providing support to the Human Rights Commission. There was an increase in TB case finding from 20,000 to 25,000 in 2022, and an increase in services generally. For malaria, reduction of incidence from 45% in 2010 to 21% in 22. The reduction of mortality also significant and continues to decrease. The grants we're launching today will be implemented by the Ministry of Health and World Vision International in their roles as principal recipients. Both principal recipients, as well as civil society organizations and communities, have an important role to play to ensure those who need services the most are reached. For all three diseases, the grants align with the Sierra Leone National Strategic Plan 21 to 25, the Roadmap to UHC in Sierra Leone 2021 to 2030, and the National Health Sector Strategic Plan 21 to 25. You have plenty of plans here in Sierra Leone, but we're aligned with them. For HIV, the priorities include the scale-up of differentiated delivery of ART and HIV care to increase the percentage of people on treatment from 80% to 98%. That's ambitious, but I think we can get there. Increasing viral load testing to 90%, increasing coverage of HIV testing for pregnant women, and the increase of pediatric interventions, and increase in the percentage of women receiving treatment from 69% to 98%. Also includes interventions to decrease new HIV infections amongst adults other than 25 years old and decrease HIV transmission in key and affected population. Also pleased to provide support along with other partners to reduce the burden and suffering from tuberculosis, with a grant that will support continuing TB treatment and care and TB-HIV collaboration for co-infection to enroll 90% of confirmed cases on treatment. There's a number of things that those grants will do. I'm making sure that the MC doesn't have to interrupt or make comments about this being the longest 15 minutes ever. For malaria, we are going to continue to support universal mass net campaigns. The most recent campaign in Sierra Leone was 4.8 million net, which is a significant number. As well as case management, we hope to increase the percentage of malaria cases confirmed and treated by community health workers from 90% to 100% by the end of the grant. There'll also be some activities to scale up school-based distribution of nets for targeted classes in primary schools, and indoor residual spraying in 21 prisons and national psychiatric hospitals. Importantly, in order to strengthen health systems and better prepare for future pandemics, the new grants include 31 million to strengthen key health systems, such as health product management, human resources for health, community system strengthening, and laboratories. The ongoing COVID-19 response mechanism will further contribute to strengthening surveillance for the procurement and installation of 3 oxygen plants. Really important stuff. Sierra Leone is an important partner to the Global Fund. We value the strong government commitment to work with bilateral and multilateral partners, many of whom are here today. We commend the government's initiative to roll out the National Health Insurance Scheme to provide an integrated and comprehensive package of essential health services to Sierra Leoneans. Your Excellency, the funds allocated to Sierra Leone are meant to be complementary to the government's financing for health. During the last Global Fund cycle, we were able, exceptionally, I underline that a couple of times, to provide a waiver for unmet co-financing commitments. Probably not possible this time. In this respect, we appreciate the government's efforts and encourage you to continue working so future requirements are met. The government of Sierra Leone's commitments to grow the government's health budget from 51 million in 24 to 75 million by 26 are important, with 6.7 million going directly contribute to the fight against HIV, TB, malaria, and the construction of a central warehouse, which others have spoken about. We encourage the Ministry of Health, PRs, subrecipients, and all implementers to continue mobilizing human and financial resources to allow the completion of the fit-for-purpose pharma-grade warehouse before June 2027. This will unlock resources from the Global Fund to support this effort. Specifically, 2 million from the government will unlock 6 million from the Global Fund. We want to make sure this project starts up on time and can be completed as soon as feasible, but certainly before the grant ends. We had a good discussion with the Honourable Minister of Finance last night. We both agreed we do not want Global Fund money left on the table and not used. So I know he's working hard to figure out a way through this. We also ask for your full support, Excellency, ensuring accountability and transparency in the use of Global Fund resources. We owe it to our donors, many of whom are here, but even more so, we owe it to the people of Sierra Leone that we serve. When operating in high-risk environments where episodes of corruption are high, it contributes to delays in implementation, as each procurement process needs to be highly scrutinized by Global Fund assurance providers. And it's imperative that the wrongdoing of a few do not tarnish the excellent work of committed health workers in the country. In addition, I'd like to ask for increased cooperation on an important matter for the Global Fund, the granting of privileges and immunities, and we appreciate your ongoing support to conclude this as soon as possible. Our legal counsel is here to help advance this matter. In closing, I'd like to express gratitude once again. The launch of these grants is a time to celebrate what we've accomplished together and renew our commitment for an accelerated implementation of the activities planned. The Global Fund will continue to support Sierra Leone and contribute to its health and development agenda. As we prepare for the Global Fund replenishment next year, Sierra Leone's achievements in the fight against the 3 diseases and to build resilient and sustainable systems for health will be key to tell a compelling narrative to our donors. I'm looking forward to seeing the future progress and to celebrate the impact achieved through domestic financing, donor and private sector funding, and these grants. Excellency, you have a great team in the Ministry of Health, and we look forward to continuing to work with them and you. Thank you very much, everybody. I'm not sure exactly who I'm supposed to present this to. I'm very pleased to present this symbolic check, I'd like to know, because the grants are already signed, to the people of Sierra Leone, represented, of course, by His Excellency the President. Please spend it wisely, Your Excellency.
Thank you very much, Your Excellency. And thank you very much, Mark, for your statement of commitment and inspiration. As our guest and a good friend of Sierra Leone, I've already created an exemption for you on the time allocation. So you're okay. Yes. We also want to ask the other members of the delegation to rise so at least Your Excellency can see you. From Geneva, member of the delegation, so we can clap for you. Thank you very much, and please be seated. Your Excellency, the significant milestones in the health sector would have been possible without the sterling leadership of your committed steward. And therefore, it's now my pleasure to invite the Minister of Health, Dr. Austin Demby, for a statement.
Thank you very much, Mr. Chair. His Excellency, Brigadier Retired Dr. Julius Maada, colleague ministers, Mark Eddington, Ambassador Brian David Hunt. Hex, if it's okay, can I stand on the existing protocols? I really want to start by saying we're so happy, we're so proud in the health sector. We have the president for the whole day. So, thank you so much, sir, for giving us the time and commitment to this sector. I would like to thank you for your vision and clear leadership. I want to thank you for your focus on investing in people. I want to thank you for clearly articulating that health is not an end in itself. Health is a platform for our national development. Sir, I want to thank you for inspiring us to assure that our healthcare delivery leaves no one behind. It is focused on all 8 million of us, and the healthcare system should see everybody in this country. At the same time, everybody should see themselves in the healthcare system. So today I'm so pleased, I am so elated to be in this space where we know that the Global Fund, a trusted partner, is fully aligned with that vision, Excellency. I think the people of Sierra Leone will get the best out of this relationship. Your Excellency, distinguished guests, it is with immense pride and profound gratitude, now I have to read the script I was going to say, that I welcome all of you to this launch of the Global Fund Cycle 7. This occasion marks another significant milestone in our long-standing partnership with the Global Fund, a partnership that has been instrumental in transforming our health system and improving the lives of our people. The Global Fund has been a steadfast ally of the people of Sierra Leone, with a cumulative investment to date exceeding $500 million. This substantial investment has resulted in unprecedented success in our fight against HIV, tuberculosis, and malaria, and has significantly strengthened our health system. Through this partnership, we have seen remarkable progress. The number of people living with HIV receiving medication has increased from 38,000 in 2018 to 69,331 by December of 2023. We have reduced the number of missing TB patients from 5,000 3 years ago to less than 3,000 in 2023. Our malaria burden has dropped from 40% in 2016 to 22% in 2021. These achievements speak to our collective commitment and the tireless efforts of our healthcare workers, partners, and communities. In addition to fighting these diseases, our partnership with the Global Fund has strengthened our community's health service and health information systems. Together, we have seen the provision of solar energy to health facilities, installed oxygen plants, prepared for and responded to public health emergencies, and built the capacity of our health workforce. These efforts have created capacity in our health system. These efforts have created a more resilient and responsive health system capable of meeting the needs of our people. However, we must also acknowledge the challenges we face with the current grant cycle 6 that ends in June, on June 30th. The issues of low grant absorption stemming from programmatic grants management and port-related challenges pose significant obstacles. Despite these difficulties, with your direct engagement, His Excellency, the Ministry of Health, in collaboration with all relevant ministries, departments, and agencies, has not only addressed these issues, but also institutionalized our response to such challenges. This means that although we went through a challenging period, we have emerged stronger, with an enhanced capacity to effectively administer the grant and utilize the funds for the benefit of the people of Sierra Leone. Today, we further solidify our commitment to this partnership by launching the new Global Fund Cycle 7. This funding will sustain our efforts in strengthening the health system and positively impacting HIV, TB, and malaria services in Sierra Leone. On behalf of the Ministry of Health, I extend my deepest gratitude to His Excellency the President, to the Global Fund for its unwavering support, and to all of our partners. I also thank our dedicated ministry staff, the country coordinating mechanism, all ministries, departments, and agencies who work with us on this grant, and all our partners who supported us during the application process of the grant. A special thank you to the US government for contributing 30% of the Global Fund's resources. Together, we'll continue to build a stronger, healthier Sierra Leone. Our journey is far from over, but with the continued support of the Global Fund and our unwavering commitment, we will overcome the challenges that lie ahead and create a legacy of health and well-being for generations to come. Thank you very much.
Thank you very much, Mr. Minister. Distinguished guests, our country is blessed to have a president who is a visionary, someone who embodies compassion and care, and who inspires us every day in public service. Therefore, it is now my privilege to invite His Excellency the President to deliver his keynote address at the launch of the GC7. Your Excellency the President.
Let's sit down, please. Ministers, Head of Delegation, Global Fund, Mr. Mark Eddington and team, Members of Parliament, members of the Diplomatic and Consular Corps, the Fourth Estate, our life-saving partners, fellow Sierra Leoneans, good morning. Since taking office in 2018, my government has pioneered the advancement of Sierra Leone's human capital right across 3 pillars: education, health, and agriculture. The commitment to increase access to health care specifically was informed by a firm belief that good health is the greatest equalizer, allowing citizens to be more productive for longer periods, giving them an opportunity to pursue gainful economic activities. But we have not been alone in this journey of improving healthcare outcomes. We have a multitude of donors and technical partners. Among our most steadfast allies is the Global Fund to fight AIDS, tuberculosis, and malaria. Together, we have intensified our efforts to combat HIV, tuberculosis, and malaria, and to strengthen health systems of our nation. At this juncture, it is my pleasure to extend a warm welcome to Mr. Mark Eddington and his team for coming all this way to launch. I'm profoundly grateful to you and the entire Global Fund family. Your continued collaboration with the Ministry of Health, the country coordinating team, our in-country technical partners, and civil society health actors has been instrumental in addressing the formidable challenges we face in building resilient health systems. Although Sierra Leone has been working with the Global Fund since 2005, this marks only the second time we are launching the Global Fund grant at the State House. We are serious about this partnership. During the inaugural State House launch in 2021, and in line with my belief in transparency, I informed the nation about the number of grants received from Global Fund and outlined also the activities to be implemented for the current Grant Cycle 6, which will end on June 30th, 2024. With Grant Cycle 6, we were able to double the number of people on treatment for HIV, halve the prevalence of malaria, and increase the annual detection of tuberculosis case over 20%. Let me use this opportunity to thank all implementers of the current grant, including the Ministry of Health, Catholic Relief Services, their partners, and other health partners. Your relentless efforts have been critical in advancing our mission to improve healthcare outcomes for our people in Sierra Leone. As a government, we've had our shared challenges with clearing Global Fund medical items and supplies. I think we've gotten over that, and we've developed a very robust system. And we will assure you that we will not have those challenges anymore. Today, we are gathered here on behalf of the people of Sierra Leone, particularly the beneficiaries of this grant, to receive additional funds from the Global Fund for the upcoming Grant Cycle 7, which will start on July 1, 2024, and end on June 30, 2027. I'm aware that the process of developing the funding request, which required collaboration and consultation in line with ministries and technical partners, was extremely rigorous, as has been alluded to by earlier speakers. In that regard, I want to commend your patience and fortitude that resulted in a successful completion of this process and securing the funds to continue to improve the health outcomes for our people. Ladies and gentlemen, distinguished guests, it is my distinct honor and great pleasure to accept that big symbolic of check, which I've already taken and handed over accordingly, transparently to $126,444,674 on behalf of the people of Sierra Leone. This substantial funding will strengthen our ongoing battle against HIV/AIDS, tuberculosis, and malaria, ensuring that we continue to make significant strides in improving public health across our nation. The Global Fund has provided additional matching funds of $800,000 United States dollars for scaling up programs to eliminate human rights and gender-related barriers to healthcare access from July 1, 2024 to the 30th of June, 2027. I'm also pleased to announce that in terms of counterpart funding, I'm also pleased to announce $6.7 million United States dollars in counterpart funding from the government as part of our commitment to improve human capital development within the big 5 game changers. When we talk, we do. This substantial commitment increases our contribution by 43% from the previous cycle, of which government met its full obligation. The Ministry of Health and World Vision International, Sierra Leone, will be the principal recipients of these funds, working in collaboration with sub-recipients and their in-country partners, including community-based organizations. With this new grant, our country team will intensify efforts to combat malaria, HIV, and tuberculosis, setting very ambitious targets while strengthening our health systems. This funding will expand essential health care services, address human rights and gender barriers, and implement innovative programs ensuring sustainable health improvements in our communities. These critical investments move Sierra Leone closer to achieving universal health coverage, which remains a commitment of my government. Towards its attainment, we will continue to increase domestic funding and intensify our monitoring and oversight activities in order to document the story of a health systems revolution in Sierra Leone. We will continue to rely on partners, including private sector, to improve the support to scale our efforts. I extend my heartfelt gratitude to the Global Fund for this support. I thank the Ministry of Health, the country coordinating mechanism, in-country partners, government ministries, multilateral and bilateral partners, consultants, beneficiaries who played a vital role in developing the proposal that secured this funding. At this juncture, it is with great pleasure that I launch a total approved amount of $136 million United States dollars, 244,674 United States dollars for the purpose of Sierra Leone to fight against HIV, tuberculosis, and malaria, and to strengthen the health system. It is now left with the ministry and other implementers to make sure that these monies are used for the purpose for which it has been given. Not only efficiently, but also transparently, so that we account for it. We pay particular attention to monitor this generous donation. So I will conclude by imploring all of us to strengthen the accountability mechanisms that can ensure that people that need life-saving drugs and treatment have timely, cost-effective, and unimpeded access. Let us constantly be reminded that these resources are for the people of Sierra Leone, and that we must be unrelenting in our effort to ensure that they are delivered at the last mile and to the most remote locations of this country. They are not just meant for the cities. We cannot speak of health systems if we can't appreciate that at the center are people, and the systems that we build are to ensure quality services and are provided to improve health outcomes at a foundational investment to sustainably reduce poverty in Sierra Leone. The task is significant, but the hearts are willing. Let us remain steadfast in our mission to secure a safe, productive, and dignified future for Sierra Leoneans through the provision of quality health services. I thank you all.
be seated. Another round of applause for His Excellency the President for those words of motivation, and Your Excellency for your dedication to promoting the well-being of every Sierra Leonean. His Excellency has consented for photo opportunity, and we will have 3 photo sessions in the following order. The first would be His Excellency the President and members of the delegation from Geneva. The second would be His Excellency the President, the head of delegation Mark, and the Minister of Health. And then the third would be His Excellency the President, the Vice President from World Vision, the CCM, Madam Rogers, and also the Chair of Parliament, Health Committee, and then the UN Resident Coordinator. That will be the last. Please remain where you are. The photo opportunity will be at the back of the hall. And we'll start with the second. And we'll now invite the head of delegation, Mark, and the minister to go to the back. You'll be guided by the head of audiovisual. The guests will remain seated whilst we conclude with the photo opportunity.
Come here.
And we also invite the members of the delegation to also proceed for the second photo opportunity.
What? From we work for welcome
Okay, viewers, hello, and if you're just joining us on AYV Television channel 33 and also on our AYV Facebook page, we've just witnessed the launch of over $136 million from the Global Fund, which is from the 7th cycle